The primary purpose of this podcast is to inform and educate. The information and opinions expressed by the hosts and guests in this podcast do not necessarily reflect the official position of the Lifesaving Society of Ontario.
Jason. So we are back for our second episode of the Lifeguard for Life podcast. Again, I'm Stephanie Backlar and I am joined by Jason Jollicoeur, my co-host. And this week we are talking about urban myths related to first aid. Jason, how excited are you for this topic?
I've been looking forward to this for several weeks now. It's going to be pretty fun.
Do you have any urban myths that have crossed your path? What's something you've heard that you're like, no, that's crazy?
One of my first aid classes I taught, it was a pretty diverse group, like a lot of different ages mainly. And one of the older members of the group said his mother taught him that for burns, you put butter on the burns. So I did a little research. I know, right? So I did a little research and found out where it came from. So in the 19th century, they thought the butter would seal the burn off from the air, which would keep it clean and prevent infections. But in fact, it makes infections much worse. So do not put butter on any burns.
That's 19th century logic.
Yes.
We're not going there. That's actually, I can kind of understand why they would think that, but we know now that that doesn't work. So no butter on burns, right?
What about you, Stephanie? Do you have something?
I mean, you always get a few odd questions in the realm of your courses. I did have one person ask if he could use his foot to do chest compressions instead of his hands. Didn't want to bend down. Thought that would be easier. So that was a pretty obvious no. But I thought that one was pretty funny. But there's always something that makes you laugh, right?
When I took bronze medallion, I actually thought, because I saw it on TV, this is for real.
Oh, TV.
If someone was having anaphylactic shock, I could do a tracheotomy and take a knife and jam it in here and put a straw in and we could breathe. I actually thought that going into bronze medallion. And I was told,
people do
Jason, no, you can't do that.
Stop watching so much television, Jason.
Yes.
Yeah, there are some scary things out there that people think. So we're today going to try to debunk some of those myths, answer a few listener questions, and, just get down to some things that we think maybe need clearing up. Okay, so without further ado, we are going to introduce, and we're super, super excited to have this person here. We are going to introduce Marek Holke, and Marek is actually currently the lifeguard and first aid manager at the Lifesaving Society. Super, super knowledgeable. I did my instructor trainer clinic, and Marek instructed that and was fantastic. I've met Marek a bunch of times through different things with the Lifesaving Society and different courses and things like that. But taking that course was where I really got to experience his depth of knowledge and passion. Excellent, excellent teacher. And he's fairly new to this role with the society. I think he's been here maybe almost going on a year, I would say. And he is doing a wonderful job. It's been great for us on the training program council to work with Marek. And we were thrilled to have him here today to answer some questions. So Marek is now going to join us and we will get right into debunking these first aid myths.
Welcome, Marek.
Hi, Stephanie and Jason. Thanks, Stephanie, for that amazing introduction. And Stephanie, you were always one of my star students. So thank you.
He has to say that. I paid him.
Okay, I think where we want to start, Marek, is we get as first aid instructors, we all probably get a lot of questions about is this a myth? Is this real? So in your new role, I bet you get even more now at the Licensing Society office. So we want to start off with, what's the most common question you think you get?
That's a great comment, because we definitely do get a lot of people asking questions regarding clarity, whether it's a clarity regarding the test that they just took, the famous 50-question test, or if it's content related to the first aid program. But I think that the most common question that we get has to do with checking for breathing after a victim vomits during the CPR process. I'm sure that all of our listeners can attest, for those that teach first aid, that's probably the most common question is, do I reassess ABCs if my victim vomits while I'm performing CPR. So without further ado, the answer is keep doing CPR. You got to keep doing CPR. If the individual is not breathing, any of the other factors that are going on don't matter, because we got to get them to receive the oxygen that their body has been depleted from. So we need to continuously do our breathing. We need to continuously do our compressions, maintaining that 2 to 30 breath to compression ratio. And we need to make sure that we're continuously doing those breaths and compressions. We would stop CPR if there is obvious signs of breathing and obvious signs of life. Now, when somebody hasn't been breathing for a period of a few minutes, that first breath that they take when they intake oxygen is going to be very obvious. So if somebody vomits, get that mask back on and keep doing those breaths and compressions. Don't stop doing CPR.
That is great to know, Marek. It was quite a big build-up to the final answer, too. Well done.
I loved it. So a listener question that we got that was really closely aligned with that was, will you see foam in the mouth while performing CPR? So Marek, I think, has a really good explanation for this that I thought was really interesting. And you explained it in a way I hadn't heard it. So share that with our listeners.
Yeah, absolutely. So one I guess thing that some lifeguards or first aiders might not know through training exercises is that an unconscious person that has been exposed to some sort of water, for example, in a drowning, during the drowning process, you're going to see foam almost every single time. Now, biologically, what that foam is it's surfactant fluid on the inside of the lungs. Now, surfactant fluid, what it is it basically coats the inside of the lungs so that it makes sure that the lungs doesn't, stick together. But when water gets agitated with that surfactant fluid, it creates this foam-like structure or this foam-like substance. So if somebody's unconscious and you're pumping on their chest, chances are that foam is going to work their way out of the lungs, through their airway and out the mouth. But what's really important to understand is that foam is not vomit. Foam will happen almost every single time. Unfortunately, when especially lifeguards see this foam for the first time, they might mistake it for vomit, and they're going to try to stop doing CPR, make sure they have their PPE on and their barrier devices on, and try to scoop that foam out and kind of work their way through. But what's extremely important to know is that as soon as you scoop that foam out of their mouth and you keep pumping on their chest, the foam's just going to come back. So the extremely important thing to do is to just blow through it. The analogy that I commonly use when explaining this surfactant fluid in simple terms is when you think about a kitchen dish soap bottle that's kind of near its end, and there's only a little bit of soap left. On the inside of the bottle, there's going to be a very thin layer of soap coating the inside of the layer. If you add in maybe a quarter cup of water in there and you give it a nice shake, it's going to create that foam, those suds in that dish soap. And when you squeeze the top of the bottle, the suds or that foam is going to come out the top of that bottle. Well, what's happening inside of the body is the exact same thing. If you squeeze, the foam's going to come out of the bottle. If you compress on the chest, foam's going to come out of the mouth. So the best thing to do is with that kitchen bottle is just blow through it and keep going. So going back to the foam in CPRs, you're going to see it. It might be, surprised when you first see it. Ignore it, blow right through it, and continue doing CPR, because the reason you're doing CPR is the person probably wasn't breathing. And the most important way to treat somebody that doesn't have oxygen is to give them oxygen. So that's why CPR is so important.
I love that comparison too to the soap bottle. That was perfect. So Marek, are you saying too, you're much more likely to get this on a victim that was pulled from the water?
Absolutely. The high factor, the probability factor is you're almost going to see it almost every single time. it's present, especially when that water enters the lungs.
Yeah.
And when water is entering the lungs, it's actually a very small amount that actually enters the lungs. It's milliliters, not liters. But even that small amount of water that does enter the lungs during the drowning process will agitate that surfactant fluid, which will result in the foam. So for lifeguards or anyone that's essentially pulling somebody out of the water, you're probably going to see foam almost every single time. However, if you're performing CPR, on the street, because somebody happened to collapse at a bus shelter, the presence of surfactant fluid or that foam probably not going to be there, because the reason that they're unconscious is a much different reason than the person that was just pulled from the water.
That's great.
So definitely, this is important for our first aid instructors to be talking about with their candidates when they're teaching, especially those NL instructors. It's really important to make sure you have that conversation.
Absolutely.
And embed that in your training.
Absolutely. And that's one of the big reasons too, that lifeguards would need to perform 2 breaths of artificial respiration, followed by 30 compressions for a victim that's pulled out of the water, because the reason that we're doing CPR in that case is not breathing due to lack of oxygen. So we treat it with giving oxygen. That's the most important thing when it comes to pulling somebody out of the water that's not breathing. Whereas going back to that bus shelter example, if somebody happens to collapse and goes into cardiac arrest or not breathing, or they go unconscious, at that bus shelter, the reason that they're going unconscious is probably something heart related, right? They might still have that reservoir of oxygen still built in their system. And that's why in that scenario, compression only CPR could work. But putting that into the pool scenario and pulling a victim out from the water, the most important part of that CPR process is the breaths. That's why we have that difference of doing 2 breaths, 30 compressions in a water scenario, and 30 compressions, 2 breaths in a non-water related scenario.
And that's great. And you guys both make great points when we're teaching our bronze levels and national lifeguard. If we are preparing our candidates with this information, they're going to be more likely to be successful if it happens to them in real life, right? Because they'll know what's coming. Should I move on to the next question, Stephanie?
Yeah, let's do it. This is a hot topic.
Yeah. So the next question here is probably a little more recent. I don't think I started getting it until a little more recently. And it probably has to do more with the fact that more people we're finding are addicted to potential narcotics and are overdosing. So some of our first aid instructors are asking, can we administer naloxone? So Marek, what's the answer to that one?
So it's Canada's very diverse, and there's a lot of areas within Canada that are experiencing an opioid crisis. And we, as one of the agency that provide first aid training in Ontario, also recognize that as well. So one of the changes that all of our first aid participants, instructors, examiners, and trainers are going to see is added knowledge related to opioid as well as naloxone use in the updated version of the Canadian First Aid Manual. So naloxone is a drug that will help to counteract basically narcotic poisoning, regardless of if it's narcotics such as cocaine or fentanyl or anything in between. So naloxone can also typically come in 2 forms. There's usually a nasal spray, but there's also a needle application for it. Regardless of which one you use, you do need to receive proper training. Obviously, there's the sharps element to needles, that needles need to be properly cared for and exposed of once used. So there's that factor as well. So if you are administering any form of medication, make sure that you do receive the training for that specific medication. In terms of our Lifesaving Society Standard First Aid program, we're going to be focusing on the knowledge component of it. And we're going to be focusing more on the nasal spray aspect of administering medication or administering that dose. Now, one thing that maybe many of our listeners might not know is that you can call your local pharmacy or your local health unit, and you can ask for or ask if they have free naloxone kits. There's many regions across Ontario and even across Canada that do provide naloxone kits based on request. They're free. There might be some training that you'll receive from the pharmacist or from that health center professional in terms of how to use that kit. And that's the training that I was referring to a little bit earlier. So that's a potential resource that many of our first aid instructors could reach out to receive those kits and get more training that way. Bringing it back to our Lifesaving Society Standard First Aid program, we will be doing an update in the Canadian First Aid Manual, providing more information regarding opioid signs and symptoms treatment, as well as the use of naloxone in the form of the nasal spray.
That's a fantastic answer. And I just want to jump in quickly, Marek, and get you to clarify the dates for the first aid updates for us, just in case our listeners aren't clear. We don't want people jumping into things that aren't really ready yet. So do you have any dates that you can share with us for those pieces? Yeah,
of course. So as everybody is probably familiar with the various different agencies that come together internationally, ILCOR, American Heart Association, and so forth. Typically these standards and first aid research happens on a cycle. So most recently, the ILCOR First Aid and Resuscitation Standards was reviewed in 2020. And we, as the Lifesaving Society Canada, has just adopted a couple of different changes that we'll be implementing into our programs. So that's one of the big reasons that we haven't released it yet in terms of our updated Canadian First Aid Manual and First Aid Award Guides, but that is coming. We're expecting the manuals to be ready for distribution at some point early spring. I'm a little bit hesitant to share the exact month.
It is a lot of work to get those manuals updated as someone who used to do that. It's a lot of work.
Absolutely. A lot of elves. And I think that the elves right now are busy getting ready for the holiday season. So we're looking at end of winter, at some point in the springtime, that the Canadian First Aid Manual 2020 guidelines will be available at lifeguarddepot.com, as well as the accompanying First Aid Award Guide. The one thing that I do want to share, just as we're talking about those resources, is that there won't be any changes to must-see requirements for the first aid instructors that are teaching the programs. However, there will be additional knowledge pieces. So in the First Aid Award Guide, some of the notes will be updated. As well as in the Canadian First Aid Manual, there will be some additional knowledge pieces incorporated into that resource as well.
I'm very excited to see those too.
All right, Jason, what is next?
So the next one is focusing on TIA. So some people ask, do we call EMS for TIA?
And so thanks for sharing that. That's a great question as well. So TIA, for those that don't know, is transient ischemic attack. And when you see it, it looks like a stroke. Oftentimes it's referred to as a mini stroke. And typically one of the signs and symptoms that slightly differs from a mainstream stroke is that it might be temporary in nature. However, a TIA, or a transient ischemic attack, can lead to a stroke. So because the signs and symptoms are the same, what we're going to be doing based on the recent first aid recommendations is we're actually going to be removing TIA from the Canadian First Aid Manual because we're treating it as a stroke. If it looks and talks like a duck, it's a duck. So yeah, the signs and symptoms for a stroke are, impeded speech, the facial droop, the arm weakness or paralysis, right? Going back to our FAST acronym, FAST, facial droop, arm weakness, speech, and then it's time to call EMS. So we don't want somebody to be caught up on this temporary signs and symptoms, whereas the important thing is we need to call EMS. So that's one thing that our listeners and our Standard First Aid participants, instructors, examiners, and trainers will see in the updated resources is that TIA will be retired.
Wow.
That's a wise choice.
Yeah, that's really interesting that you have this inside knowledge too. Like I'm eating this up. I love this information. I feel like I have the inside scoop at the Lifesaving Society's office. This is interesting too. My mother-in-law actually had suffered from a TIA. They were driving And all of a sudden, she had the droop in her face and she lost the ability to speak. So, but they were already driving. They just went right to the hospital because they were already halfway there. No. My father-in-law was driving.
Pulled over and let someone else take the wheel.
They took her right away and they said, "Oh yeah, it's a TIA, but it's it's done now. Go home. We'll book you an appointment." On the way home, it came back. She had to turn around and come back to the hospital. It was interesting. So that was my first kind of experience with that in real life.
And I don't know about you, both of you, but I always err on the side of better safe than sorry.
Yeah.
And I do teach that to my candidates as well. Like, if you are in doubt, please just call an ambulance.
Just call.
If your gut check is telling you to phone the ambulance, phone the ambulance.
Absolutely.
It's better than not doing it, right?
Absolutely.
Like, always act when you think you should. And I kind of live my life by that rule. I'd rather be overcautious than under cautious, I guess. So
if you're sure you need to call EMS, call EMS. If you're unsure, call EMS.
Call EMS.
Yeah, we're all in agreement. And my sister's a paramedic. She might not appreciate it, but your patient will. Your victim will. Just do it. Call EMS if you think you need to.
So our next question here comes from actually one of our listeners, Scott Ruddle, who is a fellow lifeguard in the community. And just on that note, if any of our listeners have questions that they want answered, you can email us at lifeguardforlifepodcast@gmail.com. And Stephanie, is that the number 4?
It's the number 4, lifeguard. Number 4, life.
That's right. So Scott Ruddle asked, Marek, care must be taken around a patient having an active seizure, lest they swing their limbs violently and knock you unconscious. So this is actually more of a myth, not really a question, just a myth. So he's saying people believe, I guess, care must be taken around patients having an active seizure because they're going to be violently swinging their arms and potentially knock you as the rescuer unconscious. So what do we say to that?
Scott, thanks so much for the question. And that is a myth. It's not always going to be 100% that way. In fact, every seizure is going to look different. When we think about drowning and how Hollywood portrays drowning, Hollywood always portrays drowning as these arms flailing, eyes wide, victims calling out for help. Whereas that's the way that Hollywood needs to show it, so that the viewer who's not necessarily educated in terms of what they're seeing is able to recognize it. And I think there's that Hollywood performance of a seizure as well, right? Where that arms are flailing. And when someone sees that, they can quickly associate that to a seizure. Those would be very severe convulsions. But seizures exist on a wide scale. Everything from something as simple as an absence seizure, where the individual might seem as though they're simply daydreaming, their eyes are still open and they're just kind of gazing. Maybe there's a little bit of loss in focus in their eyes, all the way through to something a little bit more severe, like a tonic-clonic seizure that has multiple phases, right? The rigidity of the muscles, as well as the arching of the back. And that's a little bit more of the common signs and symptoms of that more severe seizure, is the very kind of clenching and rigidity and the kind of jerking motion that they might see with their arms and limbs and so forth. So Scott, thanks so much for your question. But for the listeners to debunk it, is that seizures exist on a very colorful spectrum, everything from as simple as a daydream look, all the way through to arching of the back, rigidity of the muscles, along with convulsions as well. But it's not always going to be shaky and
yes,
dangerous.
I think it's particularly important to note in an aquatic environment, right? Absolutely. If someone starts swimming out of their lane and they're, and maybe it's more than it looks like, or if someone starts going to the
sinking
bottom,
to the bottom,
right? Like, there are some different ways, and I've seen different people have seizures in aquatic environments and do react in different ways. And knowing that the person would have seizures regularly, you would know what to expect and you would be prepared for it. But it's definitely something to be aware of,
especially if somebody is having that motor repetitive motion and they're doing something repetitively that just doesn't seem normal. That might be a reason to check, right? If you're unsure, go check it out. Go see if the person's okay. And it might be a simple, hey, Susan, are you okay?
All right.
If you're unsure, go check it out. But if
Better
there's
safe than
some
sorry.
sort of kind of light bulb that's like, I'm not sure about this one, follow your gut. Go see it.
Yeah. Right. When in doubt, check it out.
Absolutely.
Yeah.
And I remember the one seizure we had in our pool, it was just a lane swim and the person just got all of a sudden very stiff and just plummeted right to the bottom.
Sink right down.
Do you guys
Yeah.
remember the first time that you saw a seizure? And what did that look like?
The first time I saw a seizure, it was a friend, and I knew that they were epileptic, but I'd never been around when they'd had a seizure, and it honestly hadn't really occurred to me. I was a lifeguard at the time, but we were working on a project together. Old school, like high school, big Bristol board, got the markers and the scissors and the glue, and we're sitting there, and I'm on my side, she's on hers, and I said, "Oh, can you pass me a marker?" And I looked up, and she was just staring straight at me, but like looking through me. And I was like, "Can you pass me the marker?" And I'm sitting there thinking like, this is odd behavior. And then she started to drool.
Right.
And then as soon as she started drooling, I was like, something's wrong. And then got the, like, I've got to act motion. And then she tipped over and did start having some convulsions. But I mean, luckily we were young. Her parents were home. They were used to it. Obviously that's life. So they came down and dealt with it. But I was really taken aback. And I did try to move the furniture. They had like a big chest as a coffee table, and I tried to move it, and it was full of really heavy encyclopedias, but I didn't know. So I just like bashed into it and it didn't move. So, I mean, now I think that's a little bit funny, but at the time I was very like, I can't do anything that my training told me to do because she's wedged in this awkward spot and I can't move anything. And I really felt quite helpless and really caught off guard. So, but yeah, so then the next time I saw a seizure, I was like, oh, I'm prepared for this. So, and that was in a controlled environment. So I guess as a first aider, that was a fairly good experience for me.
Wow.
Jason, what about you?
I've never actually witnessed one. I just have had staff that have told me about their experiences on the pool deck. Yeah. So I haven't had it for real. And actually just another point here, because we when we introduced you, Marek, we realized we did mention, we thought you had worked for the Lifesaving Society for a year. Maybe it's felt like a year because of COVID. So when did you actually officially start?
September. So September of 2021. And the last little bit has definitely felt a little bit longer, but perhaps
you're so good in the role. It feels like you've been there forever.
Thanks
You're
very
doing
much.
such a fantastic job.
Obviously, many years of volunteering for this amazing organization, but on the staff side, only since September. So, and hopefully many, many, many more years to come.
So I think what's next, Marek, is we did some longer answers on these first ones, and they've been very, very informative. I think we're going to move into a lightning round. So
let's do it.
It's going to be like yes, no questions, right, Stephanie?
Should we do yes or no, or do we do myth or fact? Because this is urban myths. Is it just easier to do yes
myth?
Or no?
I'm wondering if it's going to work for our questions. That's all.
Oh yeah, okay. we set up our questions as yes or no answers, so you're right. Let's do that.
But Marek, you can add a little extra to your yes or no. Like, feel free to add like maybe 10 seconds of comment if you feel it's necessary. Yeah, if you need to.
Sounds good.
Okay, so Stephanie, you want to go back and forth? I'll start with the first one.
Yeah.
Okay, here we go. Marek, are you ready?
I'm trying. I just took a quick sip of coffee. Let's do it.
Let's do it. Okay. Check pulse before chest compressions for CPR.
No, because you're doing based on a person's breathing normally or not.
We almost stumped you. Do you tilt the head back for a nosebleed?
No, head forward.
Perfect. Do you put wet dressings on an electrical burn?
No, because it's an electrical burn. You put dry dressing. You got to find the entry and exit.
Perfect.
Can you do compression only CPR for a drowning victim?
Just like we talked about before, no, because the problem is not breathing and no oxygen. So treat it with given oxygen. 2 breaths, 30 compressions. The breaths is so important.
Okay, during a seizure, do we put something in the mouth?
No, don't put anything in the mouth.
Can you put peroxide on a wound?
Peroxide, no, don't put peroxide on a wound. Peroxide is not first aid. First aid is that immediate care that we give to somebody that has a wound for any purpose. Peroxide itself might actually cause a little bit of skin damage. consult your doctor or medical professional regarding the use of that stuff. In terms of first aid, no, peroxide is not first aid treatment.
Okay, last one. If a victim initially declines first aid and they fall unconscious, can you now help?
Well, you can always ask again. And if they don't refuse, go ahead.
Permission granted.
I love that answer. I love the answer. Perfect.
And let's be clear, this only applies to first aid.
Sweating.
Consent in terms of first aid.
Okay, I think that's all the questions we have tonight for Marek, right, Stephanie?
Yeah, anything else, Marek, that you want to add or anything we missed that's a hot topic?
We, like we said, I guess at the beginning of our conversation, is that we often get a lot of questions that are asked. And if it's okay to share, if anyone does have any questions related to curriculum or standards or just inquiries regarding, I was taught this, is this right? What's, the official stance or opinion? If we can share the email address for our listeners,
Yes.
If you can email training@lifeguarding.com, and we'll be able to respond to your questions through training@lifeguarding.com.
And you know what, Marek, that brings up something for me. If you're teaching and you're in the midst of a course and someone asks a question and you don't know the answer, how would you approach that?
Sharing is caring. So there's different strategies as a facilitator or instructor to navigate, answering a question that you might not know the answer to. But the most important thing is don't give them the wrong answer. It's okay to say, I don't know, but you're now obligated to make sure that they do know what the right answer is. And there's different ways that you can go about doing that. You can direct them to the resources and direct them to the Canadian First Aid Manual, First Aid Award Guide, or whatever resources are relevant for the specific question. Or you can find the answer yourself and then report back to them, right? You need to make sure that you don't give them the wrong answer, because that essentially is going to cause more harm and damage than simply acting with humility and just admitting, you know what, that's a great question. I'm not sure, or I don't know, or I'll get back to you with the answer. Now, there's other kind of teaching strategies which we won't necessarily get into regarding how to navigate those questions. You can deflect it, such as, that's a great question. Why don't you go through your resources, double check, and once you find the answer, come back to me. And then during that time, you quickly go to your resources to make sure that you are equipped with the answer for the next time, so that obviously, potentially doesn't happen again. But the one important thing is that none of us are expected to memorize every single word of every single resource. We're not robots, we're human. And it's okay not to know something, but it's also important to understand when you don't know something, and how you deal with that. That's going to be, the positive element of how you act as an instructor. So make sure that you don't share incorrect information. It's better to share nothing and get back to them regarding what that is. And at the end of the day, too, if you don't know, share the information with others once you do find that information, because one question might come from one person, but you don't know who's going to ask that question again, or who's kind of been holding on to that question themselves and didn't have the ability to ask. So sharing,
and that's how we ended up with this podcast episode.
That's right. And
so
like a lot of these questions can be answered by using your resources. And this is actually one of my favorite books. I'm going to do a little plug here. You can get this at Lifeguard Depot, but the Canadian First Aid Manual, is chock full of information. It's the best resource, I think, for teaching those classes, and it'll answer most of your questions. And again, Marek already mentioned, if it's not answering that question, send an email to training@lifeguarding.com and they will help you find the answer.
Well, thank you so much, Marek, for joining us. This was great. And I think we all learned a lot from this conversation. And as we said, you can reach out to training@lifeguarding.com with your questions. And we hope to have Marek back for another episode, sort of a follow-up episode. So if you listen to this and it sort of brought up any thoughts or ideas or questions for you, shoot the podcast an email at lifeguard 4 life. I can't get my fingers on the screen. lifeguard4lifepodcast@gmail.com. And
Thank you,
we'll
Marek.
add them to our list and bring back Marek.
Awesome. Thank you,
Marek.
Stephanie and Jason. Thanks for having me.
Take care, Marek. So
That
Stephanie,
was a great episode.
wasn't it?
That's
Very
great.
informative. I actually learned quite a bit from that too.
Yeah.
Marek has a lot of
The
knowledge.
soap bottle analogy was like
Yes.
my favorite thing that I took from that, because it's something I'm aware of, but not something I've never used that to explain it before.
And
Like,
you
I
could
talk about
actually-
vaginal breathing and different things like that, but I don't really get into that much detail on that. And I think it's really, I love a visual takeaway. Like when you're teaching, I love something that people can visualize. And I think that's a great way to keep people remembering.
And it's a good teaching tip. You could actually do that in your class and it would not take much prep at all.
Yeah. Well,
So-
I hope our listeners try that. Start taking soap bottles to your courses. It's a fun little activity.
Yeah.
So-
So our next podcast, let's talk about that.
Talk about that.
So because of COVID, this kind of pushed us into the realm of doing virtual learning, blended learning. So
Yep.
the Lifesaving
Big
Society, has started doing blended learning programs. And as instructors, there's a lot of, right? Yeah, exactly.
Yeah.
And a lot of instructors have questions about, how do I deliver a successful blended learning program? So the next one is going to be all about blended learning delivery. How do you make it engaging, fun, exciting? How do we use the tools that we have available to us to make this work?
Yeah, I think this is going to be another really good and really interesting, helpful episode. So I'm excited to record that one in the future.
Have you taught anything like blended learning or virtually yet?
No, Jason, I haven't taught in a while. I've been busy. I don't think I've taught since 2019.
Okay.
Maybe. I mean, I hadn't taught 2017 maybe before that, or 2018. Because I had a couple kids. I have 2 young kids at home, and then the pandemic. And
Yes,
so
that's right.
I'm
And
really
you
in
were
a
off.
spot right now. Yeah, I'm in an awkward spot right now where my calls have kind of lapsed. And then with the pandemic and the kids, like, when do I go and research everything? Because I'm really looking at having to go and like spend some time and research stuff. So not that I don't want to. And I think my teaching calls are actually expiring in January. So
Time to research.
take everything. I know I'm starting to kind of panic about it, but then I'm like, I haven't been teaching, so I don't know. I'm in a hole. It's going to be a hole. Let's not stress me out about it. Okay.
Yes. I actually ended up teaching a blended learning national lifeguard instructor course back in the spring. I found that one a little more challenging because when I teach national lifeguard, I like to be very hands-on. Like, let's practice all these skills and share ideas. So that one is a little more challenging. But we also did for Airy Chair Conference, a blended learning. I had to teach a bronze program in a blended learning format. And that was a lot of fun. And that was showing the candidates how to, use the Zoom tool, how you can use the resources that are already available to you to teach effectively in that format. So we'll actually touch on some of those things in the next.
Yeah, we did that
podcast.
swim clinic. So my resource development committee worked on the swim update.
And that's all virtual, right?
And that's 100% virtual, which was,
I think Patrick taught one today.
Oh, did he? That's
yes,
great.
he did.
I hope
His
he
first
liked
one.
the activities that we made. It was just interesting. I mean, I've taught a lot over the years, but I've never taught anything virtual or blended. So it was interesting to sort of help the team come up with those ideas. Luckily, we have some great people on our team who are teachers and students. And so they were great. Really, really helpful resources with that.
Yeah.
So on a personal note, though, before we sign off here, Jason, are you ready for the holidays? We're recording this. I don't know when our listeners will hear it, but we're 4 days away from.
We're 4 days away from
holidays
Christmas.
Here. So 4 days away from Christmas. It's coming in.
I'm excited for a little downtime. Going to visit a little bit of some family, spending some time with the kids. I know the kids just want to play like some games. So we're gonna do some board games and some card games.
Nice.
Yeah, just relax. And
great.
then we'll see if we're back to school in January.
It's a bit of a tough time, but it is nice to be off for a little bit, spend some time with your family. And I have little kids, so I'm really excited for them to sort of do the whole Santa thing and that kind of stuff. So yeah, I mean, it's exciting, and I'm gonna have a little time off work and whatever. So it'll be a low-key year, but That's okay.
Yeah. And the kids will love it, right? For sure.
Oh yeah. My older daughter is almost 3. She'll be 3 in January. So it's Christmas and her birthday. Like she's super, super looking forward to her birthday. And every time we mention it, she's like, I want a drum. I want a drum for my birthday.
Yes.
Like, ooh, great. She's getting a guitar and a drum. So that'll be exciting.
So a future musician
and
on
we're
our
getting
hands.
a keyboard as well, like a full,
Yes.
full-sized keyboard. I play the guitar a little, I dabble, so the kids want to get into it. So, and I'm sick of them bashing my guitar around.
Right.
So
get them their own.
Yeah. So we're getting one for the girls. So that'll be exciting.
Maybe we could do a concert on this podcast.
No one will want to hear it. I'll be singing. I don't know.
They'll be playing.
Good at. But yeah, so we will be back in the new year with our next episode. So stay tuned. And again, anything that you want to share or any ideas or questions, Lifeguard 4, Lifeguard 4, lifepodcast@gmail.com. And that's it for us this week.
Good night, everyone.